All right. Well, good morning, everyone. Thank you again for being on the call. It is Monday, September 14th, and we haven't been on the call in a while, so there's been quite a bit of news and updates in the last 2 weeks, thanks to Labor Day getting in the way there. But I hope everyone had a restful long weekend last weekend, and we're back at it. So I know everyone's preparing for AEP and open enrollment for ACA. But before we get started this morning, I do want to say congratulations to our top producing agent from last month, Mr. Jeff George. He did an incredible job. 19 enrollments for September 1st effective reported to us. Congratulations to Jeff and his team. I know that he works really hard out there to service his clients and grow his business. So congratulations to him for being our top producer of the month. So we have trainings, lots of trainings this week. The first one is here at 11 o'clock. Devoted is hosting their broker coffee hour. It is hosted by Jamie, which is stationed in Polk County market. But if you have any and all questions about Devoted Healthcare, he'll be available for you, and you can jump on that webinar or give him a call directly. He's great with text messages as well. If you prefer to get a text message update on what's going on with Devoted, you can talk to him and he'll set you up with his text message list, which is always nice to get one of those text messages once a week just to see what's going on with Devoted if you're selling their product. At 3 o'clock today, United Healthcare is doing a DSNP training. So if you need to brush up on your DSNP skills, 3 o'clock today, United Healthcare, you can check our training calendar and that's available. We're going to put it in the description in the YouTube video, but we also send that out weekly by text message, so just make sure you save that link so you can get back to our training calendar here. Tomorrow, September 15th at 10 a.m., you've got Cigna. They're hosting 2 rollout sessions. The first is at 10 a.m., the second one is at 1 p.m. So whichever one works best for you, just jump on one of those Cigna rollout sessions, and they're going to be covering pretty much nationwide what's going on with Cigna. So you can jump on the call and see what's new with them. Wellcare is also doing their rollout sessions tomorrow. Theirs start at 11 o'clock and then at 2 o'clock. So back to back, depending on how you split up those rollout sessions, you can see what's going on. Wellcare tomorrow is specifically going to be talking about the Jacksonville market, but they will have global updates on what's going on with Wellcare. So that is tomorrow, Tuesday, the 15th at either 11 or 2 p.m. for Wellcare. And then at 3 o'clock, Humana is rolling out some new plans. I believe it's for the dental product, the Honor plans, and that is for 2021. That's tomorrow at 3 o'clock as well. Moving on to Wednesday, September 16th at 10 o'clock, Aetna is doing their product training for both Central Florida and North Florida. So that includes pretty much everywhere from Jacksonville down into the Orlando market. So they'll be hosting their product training tomorrow at 10 o'clock. At 11 o'clock on Wednesday, I'm sorry, this is Wednesday the 16th, 11 o'clock, Wellcare is hosting another rollout session. This time looks like it's for the Jacksonville market again. So there's several different options for you to join for Jacksonville. At the same time on Wednesday, on the 11th, you have United Healthcare. They're hosting their virtual training. I know some of you guys are a little nervous about doing that virtual stuff. Any and all virtual trainings I would attend if you're a little shaky on how to do that process. Okay. At noon on Wednesday the 16th, one of our largest doctor groups, physician partners, is doing a town hall meeting for their agents. If you're interested in participating in the town hall meeting, that is going to be on noon on Wednesday. It's a great way to see what's going on with those doctor groups and to get some feedback on what they can do to help you grow your business. On Wednesday at 1 p.m., ACA, I know the CMS is hosting some webinars, so they're going to be talking about the HRA product or health risk assessment for ACA, so jump on there if you're looking to get some training on that ACA. Wednesday the 16th at 2 o'clock, Jacksonville again, Wellcare is hosting their training session, so you can jump on there and learn what's going on with Wellcare. Thursday the 17th, you've got Humana doing a essential training. This one's in Spanish. and that's at 10 o'clock on Thursday the 17th. On the 17th at 11 o'clock, Family Physicians Group, one of the largest doctor groups in the Orlando market, is hosting an agent webinar, and that's just to discuss what they're doing for AEP and what they can do to help you grow your business. Also at Thursday, 11:30, Devoted is hosting a Jacksonville coffee and chat session online, and you can join there at 11:30 on Thursday the 17th. Also on Thursday at 1 o'clock, Humana is hosting their virtual enrollment trainings. So they've got a lot of enrollment tools, and I'm going to talk a little bit about that on what they've been rolling out in the last couple of weeks. And we'll discuss in detail what they've got going on. But Humana is head of the pack on this. Friday, only a few trainings on Friday, 10 o'clock. United Healthcare is hosting another DSNP training if you need to brush up on your DSNP skills. That, again, is on Friday the 18th at 10 o'clock. Also, same time, Friday the 18th, 10 o'clock, Physician Partners is hosting a second town hall meeting there, so you can jump on there in case you missed the other one. And then last training for the week, FPG Agent Webinar, Friday the 18th at 11 o'clock. Learn about those doctors, figure out what doctors can help you, and then connect with them on how they can help you grow your business for AEP. So those are the trainings for the week. I do recommend, if you are looking to get that virtual training stuff out of the way, it is best practice just to jump onto those trainings and learn what they've got going on to help you have a successful AEP. All right, we are still in a special election period with the hurricanes that have been going through this area. I know you guys all know all about that. So we are still in an SEP available through the end of this month, and I had mentioned it earlier in the last video on what counties are available. So if you need that information, you can go back on our YouTube video and you can grab the counties, but you should have already gotten some emails from the plans letting you know that you still have a Medicare SEP available to help people switch in case they weren't able to use their SEP because of these storms that have been coming through. And if you've been watching the Weather Channel like I have, it seems like there's a bunch of storms out there right now, so it's possible we could get affected even further along in this season. And just keep an eye on the weather, and once a storm has passed, even though it might not have directly impacted you like the last one did, it did open up an SEP for Medicare. So just go back on our YouTube channel and you can find out which counties are available for that SEP. All right, Aetna update on their supplement. They have a brand new email signature process that starts today, September 14th. So you can, if you have a client that's ready to enroll in Aetna supplement, you can now use their new email signature. You basically just email them over the document and they can go ahead and sign via email, which is super easy. It seems everything's going that way right about now, so for obvious reasons, right? All right, Humana, big news in Humana, lots of things going on with Humana and how they're rolling out things. I want to remind everyone they do have a member care assessment form, which is the fancy HRA form that we've talked about in the past. So this health risk assessment form is basically a physical on paper, and it basically allows the customer to fill out that physical form, asking them some basic medical questions, and then that information is passed through the health plan to the doctor to get a jump start on what kind of care is needed when they first enroll into the plan. So Humana is now compensating you $50 to get that additional form filled out. I believe it's only 1 or 2 pages. It doesn't take more than about 10 or 15 minutes. But if your member completes that, you'll get an additional $50. It is you don't have to worry about chargebacks because this is categorized as an administration fee for the health plan because you're actually helping them collect data. It's not part of the sales process. So they pay you an additional $50 just to get that HRA form done. Now, it is required that you have to have that HRA training, which lives in your portal. It's an optional training, but you will not earn the additional $50 unless you have that training session done. So if you're selling Humana for AEP coming up, Make sure you get that member assessment form completed, that training done, completed before you start filling out those forms, because you will not get compensated unless you get those trainings completed. Also on Humana, they've made some updates on their portal. The first one is, pretty basic, but I think it's a step in the right direction because there's not very many health plans that are doing this right now. And that is, in the unfortunate event one of your clients passes away, they will now send you a deceased notification on your portal. The only other company that I know that sends out notifications when a member passes on is UnitedHealthcare. So Humana has joined the ranks, which is really nice. You can, send a bereavement card, or, if you knew the member personally, give them a call to their family and, express your feelings for them. So you do have those two. That notification now going to start popping up on your Humana portal system. And then this one I'm really excited about, and you can now verify Medicaid status on your Humana portal without having to call the health plan. So this is pretty cool. So you'll start to see that on your portal system where you can go in. At least you're going to have the social and date of birth to pop in that information, and Humana will verify Medicaid right there on your portal at Humana. So this is really awesome. Now, just a side note, and I had talked about this in the past, I know some of you are going to use this tool to verify Medicaid, and then possibly the person actually needs to go on a different plan. Well, if you're going to do that, that's fine. Just make sure that you re-verify the Medicaid with the actual plan you're going to be enrolling that person in. So I'll give you an example. Let's say that you start talking about Humana, you verify their Medicaid, their QMB, but then they say, I think maybe Devoted's going to be a better fit for that person. Well, before you enroll them in their new D-SNP plan, please call Devoted or check with Devoted to see what their status is, because that might not reflect the same information with the state. So if you put that in QMB, it may not allow them to join that plan. So just be very careful to actually re-verify the Medicaid level with the actual plan you're going to be enrolling them with. I know some of you have run into this issue in the past, so it's just a reminder to make sure you do that. But I thought that was exciting information regarding Humana, so you can verify their Medicaid. And side note on that, Care Plus is a Humana product, so you can verify Medicaid, and it should be the same information that resides in the Care Plus system as well. So pretty cool little feature that they have there. I hope some of the other plans jump on board with that. So with Simply a couple updates with Simply Healthcare on recertification. In the past, we had to go face-to-face. They are no longer requiring face-to-face recertification training, but they will send out a slide deck and training that you will need to complete along with your Anthem online training, and you'll just need to follow the instructions on how to get recertified on Simply, but there will no longer be a face-to-face requirement for recertification. So that makes life a little bit easier, and hopefully you can get through those trainings a little faster. Also with Simply, they have rolled out a new voice signature training, which allows you to remotely enroll your Simply clients into the plan right over the telephone. So you'll have a voice signature application process that you can go ahead and get set up with through your training, but you do have to complete that training with Simply in order to get access to that and to ensure that they get trained properly and you use that service properly. So again, these trainings, anything that piques your interest or that you've got to work on, spend the time now. Do not get caught up in trainings in the middle of October, November when you should be selling, okay? This is, training to get ready for the season. This is what this is what you're working for, right? Just a quick note, Devoted Healthcare had sent out an error mailer to their clients. And what this mailer was, if you have Devoted clients, was they basically misquoted their over-the-counter credit in their catalogs for those members. So if you're a member with Devoted, you got a letter basically saying that you've got X amount of OTC product. Well, the value was actually wrong on that, so they're sending out letters again saying that we're sorry, we actually misquoted your over-the-counter credit. It's really this amount. So if you do start to get phone calls from your members saying that Devoted's mailing me about, the OTC, that's what it is. It was an error message just on the actual number that they sent out for those members on certain plans. So just be aware that they are mailing your members, letting them know that they made an error on the actual value of the over-the-counter credit. Not a big deal, but I know, we always want to know what the health plans are sending out to our members, because your members call you and you have these conversations and you'd like to know what the heck is going on, right? So there it is with Devoted. Moving on to Wellcare. Wellcare now has a mobile scope of appointment opportunity that you can go ahead and use via the Ascend tool. Those of you that have dabbled with the Ascend tool, it can be somewhat complex and cumbersome. I know that some of you are frustrated with Ascend from previous experience. Right now, all of Centene is using Ascend, which includes Wellcare, and then you've got Aetna as well that is using that product. But I was given some tips over last week. Joey Anselmo, who's the broker director, had mentioned that you really just want to get in, get out, send the scope of appointment and do that. I guess it's the express enrollment option with Ascend, with Wellcare. Just jump right into the app and get it done. He says if you mess around with the providers and the formulary inside the application, it becomes somewhat messed up, if you will, for lack of a better term. So just use that express lane in the Ascend to get your Wellcare enrollment done, which also now includes a mobile scope of appointment where you can actually text that scope of appointment over to your members, and that's through Ascend. So you want to make sure that you're familiar with Ascend. They're going to be talking about that on the rollout sessions on how you can get certified or trained on the Ascend product. Just please make sure that you get that done so you are ready to roll for 2021. Okay, wow, lots going on, right? Bright Health. Bright Health is, they had wanting to get your training done. All of you that had submitted your training by September 7th were entered into a contest to get a free iPad. So if you got your Bright Health training done as of last Monday, you are good to go to enter the contest for a free iPad. Thought that's pretty cool. So you're in the running for that. Outside of that, everyone can participate with the two contests that they got going on for AEP. So if you write 3 applications for your 1/1 effective, just 1, 2, 3 is what they're calling it, you can get up to $125 towards your AHIP paid back to you. So you'll see that across the board. There's many different companies that are reimbursing for AHIP. So I thought that was a pretty cool thing that they're doing. So the 1, 2, 3 applications, you get your AHIP paid for on Bright Health. So that's just for 1/1 effective. Easy peasy, very easy to do. Those of you that did it last year, it's the same contest. But also, if you're doing your e-application, you get an additional $50 just for doing an e-app. Okay, this is not the HRA forms that we were talking about earlier with Humana and Aetna, where you can get, that extra administration fee for filling out the health risk assessment form. No, this is just doing a regular e-application. You get $50 just for using their e-app system. So, do the math, guys. If you're doing, 50 Bright Health applications for AEP for 1/1 effective, it's $2,500 extra just for doing your job, just for doing an e-app versus a paper app. It really helps on their administration costs. We're a big fan of that too. We're going to be rolling out an e-app contest for January 1st effective. But just take a look at that. That's an incredible benefit just for using e-app systems. And I could tell you that Bright Health's e-app system is pretty flawless. It's very, very easy to use. There are trainings on your portal, so make sure that you go on your portal, and they've got on-demand trainings on how to use their eApp system. Pretty easy. I would save these videos in your bookmarks, so in case you get jammed up on an appointment and you're like, uh-oh, I don't remember where to go, just make sure that you bookmark that. We're going to be sending out to our team links to the enrollment centers and platforms for each one of the carriers, as long as links to the providers and formularies. So all of you that are contracted with HPM, we will be sending out those links, so it'll be easy for you to access that stuff quickly and efficiently. All right, so that pretty much wraps it. Just a couple of house cleaning things here at the end here. All of you should have already started calling the clients for AEP. Those of you that are working with Sergio know that we're helping you call those clients and getting a hold of those clients. But you should have already started that effort, because your number one lead source every year, number one lead source is client referrals. So make sure you're touching back with your old clients, making sure they're happy with their plan. And if they're not, you know that you can present a plan starting October 1st and see if you can help them get enrolled for October 15th for January 1st effective. Just get in touch with them. And the other part of that is maybe you lost a few clients over the last 12 months or maybe even longer. Maybe you have old clients from 2, 3, 4 years ago. Send them a letter. Let them know that your AEP's here. We can't call them, right, because they're not our clients. They have Medicare. But you can send them a letter. You can send them an email, because that is allowed. They just have to have an opt-out option on there. But all that old business that you may have lost in years past, this is a great time to try to recruit them back. Maybe they're, they haven't heard from their agent, or they're not happy with their plan that they enrolled in, and it's time for them to change again. So you want to be the person to do that, obviously. And then the last thing is your kits. Okay, so Healthline Markets did order kits for all the health plans. We'll be getting supplies, but it is going to be limited, and it is going to be on first come, first serve. I know some of you are traveling, or some of you feel more comfortable working remotely. That's absolutely okay. Just make sure that you're ordering the kits directly from the carriers. So if you know that you're going to sell approximately 50 Wellcare applications, make sure you've got 50 kits on hand, okay? We're here for backup in case you hit that 51 and 52 and 53. We'll be able to supply, those 2 or 3 extra kits for you. But it is going to be on demand, so I do highly recommend that you order your own kits. If you haven't ordered your kits, it is the 14th. We have time to get kits before October 1st effective, or for October 1st for January 1st effective. Just make sure you're ordering those kits. If you don't know how to order kits, please call the broker support line at the health plan, and they will direct you on how you can get your kits ordered. Many of you are familiar on how to go online and get that done, or you can call into the company, and some of those will place the order right over the phone for you. But it's better to do online, because you can actually see what kits are available and which ones that you're going to want to order. Okay, with that, I am done for today. So I'm going to open it up for questions. So if you have any questions, now's the time. I'm going to go ahead and place everybody off mute here. If you do have some things going on in the background, if you could please mute your phone, that would be great.
Justin, Kathy, good morning.
Good morning, Kathy. Good morning.
Do you know when Freedom's going to open up for ordering marketing supplies as well as Health First?
I know that they're working on that online, but we did order some kits for Freedom, so I know that we'll have a big shipment coming in, Kathy. So if it gets a little close to the wire, we'll be good on that. I have not heard from Health First yet, so I know that the training's out, but they have not released any instructions on how to order kits yet. So I will keep you guys posted as soon as I hear that. Okay. You got it.
Justin.
Yeah, I think Will was there. Go ahead, Will.
Justin, quick question regarding Freedom. When I did the training, they were talking about doing some kind of a call-in to use their people to get people enrolled, telephonic enrollment or something.
Yeah.
A telephonic enrollment?
Because typically I do them online using their, using their app, online. And,
right.
That's typically, give me a scope of appointment done. And, typically I enrolled them, but I don't know, there was something that either I misheard where Victor was saying something along the lines that we have to engage their people to do an enrollment. I don't know, their telephone people, I don't know.
Yeah, absolutely. So he did mention that on the call. I don't have any additional information on how the telephonic enrollment works. I would assume at this point we would call into broker services and they would guide us on that enrollment process. But as soon as I have more guidance from Freedom, I'll send out an email on how to get that done. There may be additional training regarding these training sessions for telephonic and remote applications. So guys, just please make sure that you're aware of that because, you know, I know some companies will not allow you to use those systems unless you have that training specifically done. So just pay attention to the trainings and the notifications that are coming by email. And please, guys, please take your time and read these emails because we're getting a lot of questions that are answered right there in the email. Okay, so, but yes, to answer your question, Will, I did remember him. You are correct. He did mention that the telephonic enrollment would possibly be an option for AHIP. But, again, I don't have that information from Freedom just yet, so I will send it out to everybody once I grab that.
Okay. Well, thank you.
Justin, can I just respond to Kathy's inquiry regarding the Health First kit?
Yes, thank you, Cindy.
So for all the agents who are ready to sell, Health First will be mailing you your kits directly.
Oh, they're mailing it? Okay.
You don't need to order anything. They'll be sending them to you.
Yeah, they only mail, I think, 10.
Yeah, if it's limited, Kathy, once you get that first order, just let us know how many additional kits you'll need, and we'll work with you on get that done for you.
Okay, thanks.
Hey, Justin, Tom, I think one of the things everyone's going to have to keep in mind during the Wellcare training, they said that their office is not going to be open until January. I think Humana is going to be in the same position, so ordering material and figuring out how to get to the carrier and order material is crucial. Because you're not going to be able to just pop in offices. For the most part, they're all going to be closed. And then regarding the telephonic applications for both Freedom and Aetna, the client is going to have to call in and initiate the call. So whether you're on a three-way and you make the call for the client, or you give the client the pertinent information, like Aetna says, you have to have the client has to have the agent number as well as the NPN, and then they call in. But the call has to be initiated by the client, and then the agent gets credit for the app. But and the agent can't be on the phone when the actual application is taken.
Okay, and that's for both Aetna and Freedom?
Yes.
Okay, awesome. Awesome. I appreciate that. Thank you. Yeah, so it's going to be crucial that you walk your client through that process, guys, and let them know, and make sure that they have your agent ID, and then they notify the person that's taking the application that they have an agent and they have your agent ID. Also, just make sure that you're tracking this because we can see that this could become an issue in the future for telephonic applications. Just make sure you're tracking it. And the best way to track it, guys, report your applications. That's why we do what we do, so we can get involved and help you because the data is already in the CRM system, so we can jump on board and help you out, okay? Tom, thank you for that. I appreciate it. All right. Any other questions this morning? And please make sure that you're not on mute. Some of you may be on mute when you're asking your questions. All right. Any other questions this morning before we go? Fantastic. All right, guys, I appreciate your participation. We'll meet here again next Monday and throughout AEP to keep you up to date on what's going on out there. I appreciate it. And again, if you have any suggestions or if you have anything that you'd like me to cover on this call, please shoot me over a text message, an email, a flare gun, whatever works for you, and we'll be glad to cover it for you. Thanks again, and I hope you guys have an awesome and successful week this week. Take care.
Thank you. Bye.